Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Nishat Uddin. She's a public health professional. Today's Kevin MD article is Why Culturally Compassionate Care Matters for South Asian Communities. Nishat, welcome to the show.
Thank you so much for having me today. I'm looking forward to this discussion.
All right, let's start by briefly sharing your story, then we'll jump right into your Kevin MD article.
Yeah, sounds great. So, my background is in public health communications and healthcare strategy. So, I actually started my career in health communications and public relations, working at some of the world's largest agencies. So, during that time, I supported a wide range of clients and worked across multiple therapeutic areas. And so, those experiences really kind of gave me a front row seat to how messaging, representation, and cultural context really shape how people engage with care. But it also made me realize how often the South Asian population specifically were missing from those conversations. So whether in research, clinical trials, or broader health narratives. So that realization really inspired me to create South Asian Care, which is a digital health platform and provider directory designed to connect South Asian communities with healthcare providers who understand their languages, cultures, and unique health needs. So most recently, I've been working and focusing on growing South Asian care.
All right, so let's talk more about your Kevin MD article, Why Culturally
Mhm.
Compassionate Care Matters for South Asian Communities. For those who didn't get a chance to read your article, tell us what it's about.
Mhm. Yeah, so the article came from both a personal and professional experiences. So for years, I worked in spaces where public health and healthcare storytelling narratives intersected. And while the industry has made progress towards a lot of diversity and inclusion, South Asian narratives are often overlooked or
Mhm.
generalized in these narratives. So that gap has real consequences. And so when cultural beliefs, stigmas, or family dynamics aren't quite understood, people really tend to disengage from care entirely or delay seeking help until it's too late. So I wanted to use this article as a space to give language to those experiences, to show that when providers understand a patient's cultural context, it can really change everything from diagnosis to treatment adherence. So, for example, just understanding why a patient may prioritize family involvement in decision making, or why certain topics like mental health or reproductive health carry stigma can really help clinicians approach care more effectively and empathetically. So I speak a lot about that throughout the article. It was also important for me in the article to shift the conversation away from cultural competence, which can sometimes sound static, as if you can check a box and say,
Mhm.
you understand a community. But I wanted to shift it towards cultural compassion, which is more relational, ongoing, and grounded in true empathy. So that's kind of the foundation of the work that I do. It's not just about connecting people to providers who look like them or speak their language, but to providers who genuinely value the cultural nuances that influence their health behavior and ultimately build trust. So in many ways, the article was both a reflection of my own journey and a call to action for the healthcare community just to see cultural understanding as central, not secondary to quality care.
So you note in your article that South Asians sometimes are grouped into broad Asian American categories. So what's the single biggest health need that gets erased when this happens?
Certainly. When we're all come together, then you tend to overlook what exactly is important to these communities. And when we're looking at different regions, of course, there's different types of, things that are important. But specifically looking at South Asians, and it's kind of a way to group data together and look at, what is most relevant to these groups. Sometimes if we look too generalized, we miss what is actually important and what the data is saying about what is impacting these populations. So if we go too general, we miss what is actually important to those subgroups. But if we are able to kind of generalize it a little closer, we're able to give better healthcare to those groups because we actually acknowledge what is impacting them, what, their health disparities are. So but overgeneralizing, we can really miss a lot of those important things and also those important conversations to have.
Another thing that you mentioned in your article was dietary disconnects around staple foods. Give us an example of that and maybe how a clinician can address that in the exam room.
Yeah, absolutely. I think that's one of the biggest areas. And, South Asian communities in particular have very specific, diets or cultural needs. And, whether they eat a vegetarian diet or whether they eat very specific foods, kind of different types of areas. But it is very important when, a clinician can work with them as far as their diet and health needs because you can't just tell a certain population that you can't eat your staple foods. That is very hard for someone. So kind of having that understanding that these are a part of their culture, these are a part of, just the things that they thrive on day to day, and understanding that and just finding a way that you can work with them to adapt what is important to them. So instead of taking things that are important out of their diet, just kind of helping them and educating them on how they can incorporate other healthy things into their diet and how they can moderate things that may not be as healthy for them. But elimination diets don't necessarily work for a lot of groups of people, specifically South Asian communities, because food is a big part of the culture too. So
Mhm.
it's kind of a larger understanding of what's important to them. But certainly that is also one of the biggest parts, with when it comes to healthcare in South Asian populations. Sometimes it can be the food that can be harmful to the community. So it's a fine balance of both.
You mentioned earlier that a lot of physicians, we only have like 10 to 15 minutes to spend with a patient, especially what I do in primary care. And of course, culturally compassionate care isn't just about memorizing checklists, right? So, what are some open-ended questions that I can ask South Asian patients in the exam room?
Yeah, absolutely. I think there's a few ways to go about it, and especially, if you're on a short amount of time. So, to your point, asking open-ended questions, it can be, more related to their diet being number one. Family is actually a really big part of it too, whether it's family history, family relationships, and also just kind of about their cultural practices, if there's anything in that is, coming into play. So, those type of things, and also just understanding their baseline education. I'm saying that can be, kind of a hardship for a lot of people because a lot of communities don't have the understanding of what's going on with their health, what they're looking for. So just kind of understanding where they're at and
Mhm.
meeting them there and helping them kind of reach where they need to be.
One of the other things that you mentioned was collective decision making and the impact of a patient's family. So let's say there was a situation where you get a sense that the family at home might not support the medical suggestion that's being made. So how can a clinician navigate those family dynamics?
Yeah, absolutely. I think a lot of it comes with education. And I
Hmm.
think sometimes the reasons that in this kind of collectivist community that a lot of people don't support decisions are, perhaps maybe it's a topic that is related to stigma. Secondly, it can be just a lack of education. So I think empowering the patient to have that education, to have the conversations with the family, because as a clinician, you're not always going to be speaking to the family. It's more just the patient relationship. So really empowering them to give them the tools, the language they need to relay that. Sometimes a patient might go home and say, this is what the doctor said. I don't really know, but I'm going to do it.
Hmm.
And, sometimes families may feel hesitant to support those decisions because they just don't have the information that they need to support it, which can be understandably fair. So I think really empowering patients to have the information they need to relay that to their families. And I think that, I think a lot of the reasons that people delay care or don't support care is lack of understanding or education around what the issue is.
When it comes to culturally compassionate care, I think that trust obviously is a foundation for that. So what are some of the red flags that you see? What are some of the quickest way that clinicians can lose that trust? What have you seen done in the past?
Absolutely. I think, a main thing is just kind of overlooking what patients are there for or what they're discussing. I know just from one thing that I have heard largely from the community is women with PCOS. That is quite prevalent in the South Asian community. And in years past, I know there's been a lot of progress in that and a lot of new data on it, but a lot of South Asian women felt overseen, overlooked, and not given the time for discussion about, things that were impacting their bodies that they believed to be PCOS, but, a lot of them felt just overlooked. Doctors weren't considering that it's more prevalent in certain populations or looking into it further. So I think there have been certain areas where patients do feel kind of just overgeneralized, overlooked, and just not given the time to, for providers to really focus on thinking, hey, the South Asian population is more at risk for XYZ. Maybe we should look into this further. The patient is saying they have these symptoms. We should do some more tests, etc. So sometimes I see that patients are feeling overlooked,
Hmm.
overgeneralized, and not given the time and attention, especially when data is showing that certain things are showing very
Mhm.
clearly in the communities.
So let's zoom out a little bit and talk about public health messaging. You're obviously an expert on that. Is there a campaign or a story where culturally compassionate public health messaging was done really well? What would that look like?
Yeah, absolutely. And you know what? I think a big part of public health campaigns is the culturally compassionate care that is lacking. And I think that's kind of what drove me into creating this. I think in a lot of the work I have done has been very, very targeted, not broadly including culturally compassionate care. I think, we're making great strides. I think there has been quite a significant amount of work done in specific populations and, South Asian communities is just not one. I personally have not seen one very large campaign yet that has resonated with me, which really drives me to help create that. And just as someone personally growing up as South Asian, I have never seen myself in communications when it comes to healthcare. And so I really wanted to create, the resources for people to find something that they can relate to because that is a very large population that is being left out in these messaging.
So what would that look like? You said that there hasn't been a campaign that you've seen that has personally resonated with you. So especially in this era where a large part of the public has lost trust in our public health institutions, what would some of that culturally compassionate messaging look like?
Yeah, absolutely. I think it's things that specifically starting with the South Asian community are prevalent to them. So things that we're seeing a lot more, whether it's related to diabetes, heart disease,
Hmm.
things that are very, very large in the community, but also things that are stigmatized in the community. I think that's a really, really big area too, whether it's mental health, reproductive health, sexual health. There's so many topics that are often not spoken about in the community. And I think that's a lot of where the discussion begins because, a lot of these communities are hesitant to even put information out due to the
Yeah.
stigma. So that's something I'm really passionate about is breaking down that stigma and putting information out there. Just because it's a hard topic to talk about doesn't mean it's not important. So that's something that, of course I talk about everything within the health world, but I really do like to hone in on topics that are not often spoken about in South Asian households. So it can be as simple as campaigns on those topics. It
Hmm.
can be, I think one other thing that's really important too is offering these campaigns in different languages
Mm.
because the South Asian population can speak a number of different languages. So having those resources available is very, very important for the messaging to land in those communities and to increase the education.
So let's talk specifically about mental health. Like, how can
Yeah.
we relieve some of the cultural stigma around mental health that is present in some communities?
Absolutely. I think the first part is it begins with discussion and communication. I see a lot of younger generations now are, being more open to talk about these things, especially with, their parents, their grandparents, elder people in the population. And I think that is helping a little bit with breaking the stigma. And, before, if you were a young person in a South Asian household, you would never tell an elder that you were seeking therapy or help. But now that's changing a little bit. We're seeing a little bit of a shift. People are having more open conversations. Other different types of populations are seeking help for themselves as well. So I think just kind of creating the education out there. I do a lot of webinars, just basically mental health 101 for South Asians.
Hmm.
And it's just education on what mental health is because a lot of people don't really understand it. They're very quick to say, I don't need it, I don't believe in it,
Hmm.
but they don't really know the benefits, what it is. So it starts with very simple education, I believe, and showing them what it can do for them, what the benefits, and I think just a lot of group communication. The more people, especially the South Asian community, they're very much into communication and collectivist
Yeah.
opinion. So if they hear one person is, seeking mental health resources or therapy, they're more inclined to also do so themselves. So it's kind of a chain reaction. And before we didn't even have discussion on the
Hmm.
topic. So I think that's the really main essential part of starting all of this.
We're talking to Nishat Uddin. She's a public health professional. Today's Kevin MD article is Why Culturally Compassionate Care Matters for South Asian Communities. Nishat, let's end with some take-home messages they want to leave with the Kevin MD audience.
Yeah, so I think representation and cultural understanding can truly save lives. When we acknowledge the diversity of our patients' lived experiences, we strengthen our healthcare system as a whole. And at the end of the day, culturally compassionate care isn't just about awareness, it's about action. So thank you so much for allowing me to share this today.
Well, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much. Have a great day.